An alarming increase in the number of suicides, particularly among young Indigenous people in the Queensland mining town of Mount Isa, has led to calls for more mental health services for rural communities. State and federal governments have pledged support for the iconic town, while grieving relatives and health workers point to increased drug use as a factor. The ABC's Penny Timms reports.
It's a silent killer, and it's robbing this remote community of its young people. Statistics from the 2006 census put Mount Isa's population at just over 21,000. Yet there have been between 20 and 28 suicides this year alone. Many of those who died were under the age of 25.
This isn't normal. We need to find out what's happening in our town and to our people especially.
Mount Isa is an economically strong community. Mining is its backbone and provides limitless royalties to the government. But residents are hurting. Health workers describe it as a poisonous epidemic. The families of victims want answers and government help.
You know, we pay a lot of taxes. It wouldn't hurt for them to do something for a small place. You know, everything gets done in cities, but what about the small country towns? Are these lives not as important?
Vicky Prospero's son, Isaac Marquez, took his own life 6 months ago. Isaac was 1 month shy of his 18th birthday. His mother says there were no signs that her son was at risk of suicide.
He was meant to start work on the Monday. He just got a job, and I told him how proud I was, and he said, "Yeah, I know, Mum, you know, everything's turning out good." And the next day, that was it.
It's believed Isaac took drugs for one of the first times that night. Ms Prospero believes that played a significant role. She hopes that by speaking out, she will raise suicide awareness and prevent more deaths from occurring.
When you're hurting this bad, you don't want to see other people suffer like this. It's very hard to see another family go through it.
Ms Prospero says she's been approached by several teens since Isaac's death, all needing help but not wanting to use the traditional avenues.
They say, "Oh, go to mental health." The kids don't want to go there because it's like an institution. They don't want to go to churches where there's also help. You know, they need something that feels to them like a place where they can come, talk about their feelings with each other even.
The state and federal governments last week pledged support during a forum in the town looking into suicide.
Whether the precise figure is 23 or something near it, it's very clear that there is a very concerning spike in suicide numbers. And it seemed clear to me from the summit that Bob Katter organised last week that the overwhelming at-risk group is Indigenous Australians living in Mount Isa and also in some of the surrounding areas.
Mr Butler says the government realises it needs to think outside the square.
Whether there are some investments we can deploy during the night time, whether that's the old night patrols that used to exist in Mount Isa or something along those lines.
Mount Isa currently offers a number of mental health services. They're in the form of hospital care, psychiatrists and psychologists. But Mr Harvey says they aren't working. He'd like to see a more contemporary service like Headspace open.
We're too top-heavy. We're focusing on a lot of government agencies trying to deliver clinical services, but now we're sort of trying to focus that to a bit more of a community-orientated service.
Traditional owners say the majority of suicides have been young Indigenous males. They too believe drugs play a role. Chroming, the inhaling of dangerous substances, has been an ongoing issue in Mount Isa, and anecdotal evidence points to an increased use of drugs like ecstasy.
I think Mount Isa, Australia and the world, in fact, are struggling with... We probably have the biggest fight of our lives now because there's these serious drug problems, and they're the hard drugs.
The women want a greater focus on healing and support. Ms Craigie says the deaths aren't only hurting friends and family, but are destroying a culture.
You know, when we lose our elders, we lose our past. But when we lose our youth, we lose our future.
But getting people to initiate talk about mental health can be a challenge. In fact, one of the main government health agencies in Mount Isa was unable to provide anyone to speak on camera because none of those on duty had media clearance. Elvin Harver agrees it's a painful subject, but one that needs to be discussed.
There's still a lot of people that are very raw and tender inside. I mean, the last suicide we had was 3 weeks ago. You know, there are many more that have tried to commit suicide in this week alone that our services that have had to assist.
Penny Timms, Lateline.